Costs are on everybody's mind in healthcare, and physicians really potentially play an important role in discretionary spending in healthcare and in utilization of healthcare resources. And many ethical codes have called for physicians to exercise a responsibility to help distribute healthcare resources more justly and to also meet the needs of individual patients. Nobody really talks about how physicians can do both of those things at the same time. And we want to first make sure that physicians actually were on board with the idea of controlling healthcare costs as part of their job, and then figure out how they navigate that and prioritize those trade-offs potentially between individual patients and meeting society's need for cost containment. Well, the answer would be interesting either way. If physicians said, hey, it's not really our job, that would be an interesting finding from a health policy perspective. From the perspective of professionalism, we would at least like to think that physicians have some sort of eye toward addressing healthcare costs, while at the same time not abandoning their core commitment to patients' best interest, individual patients' best interest. So we wanted to see if physicians were on board with both of those commitments. The vast majority of physicians do say that they feel an obligation to help control healthcare costs. They feel like that should not compromise their core commitment to individual patients, for sure. And in the whole scheme of things, they feel like they might be less responsible for controlling healthcare costs compared to other stakeholders in the healthcare utilization universe, like insurance companies, malpractice attorneys, and even patients who want things. They feel like everybody has some degree of responsibility, and they feel like they're only one component of a much larger scheme of responsibility to control healthcare costs. They see addressing healthcare costs as their job, but not their main job. They don't want to say it's out of bounds for what they do, but their main job is to take care of patients, and they're not the ones who set prices for things. They're not the ones who even necessarily create guidelines all the time. They're just the ones in the trenches doing the work, so to speak. So I think what you're hearing from them is that they're one component of a larger, very complex system that sometimes doesn't always stack the deck in their favor. But on the other hand, they do have some responsibility. That's how I interpret the finding. We could have found that physicians would just say, nope, not my job. And physicians affirm the idea that healthcare costs is part of their sense of responsibility as a professional. We also found that when push comes to shove, physicians will choose the best interests of the individual patient in front of them over issues of cost. So those are two key findings. And then a third finding would be that they really favor innovations to address healthcare costs that improve quality of care and improve evidence-based decision making, but are much less enthusiastic about payment reforms, cuts to Medicare, elimination of fee-for-service models for reimbursement as a way to get toward better cost containment. Those kind of innovations make them nervous. There are all sorts of things we do in healthcare that we assume patients want, but we don't ever ask them whether they want it. There are all sorts of aspects of hospital care or care pathways where patients get a lot of things done to them before we even ask them whether it fits with their situation or whether it's the right thing to do for that individual. So bringing the patient into the conversation more, do we need this test? Should we have this treatment? Is this usually indicated therapy, like a CAT scan for a headache, really necessary in this case, given everything that's going on with the patient? Or is it just the usual thing that we do because we're used to our routines? So that would fall in the category of waste, right? It's not what the patient wants. It's not really what the physician thinks we need, but it gets done every time somebody comes through the door with X. That's an area where it's obvious that physicians want to see change, so that the cheap thing is the easy thing, And it's often the thing that also is consistent with what the patient wants. We should look for those kind of win-wins. I talk to patients a lot and they ask me, is the Affordable Care Act or Obamacare going to change my care? And there's a lot of fear and nervousness that physicians may not have the best interests of their patients at heart. At least from this survey, physicians are holding the line saying, we've still got patients' back, we want to have their back, in a very complicated situation where it's not easy for physicians to uphold competing commitments. But physicians still say they want to do the right thing for their patients, and they realize that healthcare costs can't be off the radar screen. So I think for the most part, it's reassuring for patients that physicians haven't sold out to the needs of society at their expense, that the profession still has a strong heart to do the right thing. And obviously we need to create the conditions in reformed healthcare that allows physicians to continue to do the right thing for their patients.